Sure. The TROPHY-U-01 trial was a very exciting trial that was presented at this ESMO virtual meeting in 2020 by Dr. Loriot, specifically cohort 1. This trial was a single-arm phase 2 study evaluating in cohort 1 specifically single-agent sacituzumab govitecan, or IMMU-132, which is an antibody-drug conjugate against TROP2 in patients with previously treated metastatic urothelial cancer. These patients had prior chemotherapy, platinum-based chemotherapy, and prior checkpoint inhibitor, and they were enrolled in the study to evaluate the safety and activity of sacituzumab govitecan as a single agent in cohort 1. The median number of prior therapies was 3, and there was a range between 1 and 8 prior therapies in these patients, so a heavily pretreated patient population. And 88% of patients had at least one Belmont risk factor, so this was definitely a group of patients with very high-risk disease, progressive in prior therapies, and with negative prognostic factors. Despite these negative baseline prognostic factors, the overall response rate in cohort 1 of this study was 27%, comparing very favorably to historical benchmark of single-agent taxane chemotherapy or single-agent vinflunin chemotherapy. And this very promising overall response rate of 27% in this heavily pretreated population, I think is really setting the stage for a future phase 3 trial called TROPHY-U-04 that will compare in a randomized fashion sacituzumab govitecan, this antibody conjugate, against single-agent taxane or vinflunin, with primary endpoint of that future phase 3 study being overall survival. In the TROPHY-U-01 trial cohort 1, we did see a very promising duration of response that was about 6 months in those patients as a median, and also a median PFS of 5.4 months, and also a median overall survival 10.5 months. Obviously, the PFS and OS data from a single-arm phase 2 study have to be taken with a grain of salt because there is no randomization. There may be some selection and confounding bias there. However, the PFS and OS data from cohort 1 of that study are very promising and definitely setting the stage from the phase 2 study, the phase 3 study that will happen in the future. In terms of toxicity, we showed what we expected with this agent. For example, we saw neutropenia. However, the febrile neutropenia rate was not that high, specifically grade 3, grade 4 events were about 10%, and only 30% of patients utilized growth factor. So with those reductions and or growth factor support, I think the agent is usually relatively well tolerated, and the neutropenias are usually manageable. The diarrhea seems to be situational and usually managed, controlled with antidiarrheal medication, difenoxylate, loperamide, and others, and proper education of patients. So definitely we have to keep an eye on the toxicity, but the overall toxicity profile was manageable. And combined with a promising overall response rate, I think this agent has, in my humble opinion, the potential to change practice in this setting, especially in heavily pretreated patients.